I think one of the best qualities you can have as a physician is to be able to look inwards and reflect on all of your patient cases. One of the most valuable things we can do as emergency medicine physicians is to reflect on patients' care after they've left our emergency department or after we've left the emergency department. I find that some of the best learning when it comes to figuring out what happened to patients, figuring out what I would do for a similar patient in a future case, is to see what happens to the patients I sign out to my colleagues, to see what happens to patients during their inpatient stay. And, I can further add that type of stuff to my workup, to my initial suspicion and initial differential diagnosis. And I find that I learn most from the cases that make me very uncomfortable. The cases where I missed something, the cases where I didn't even consider something. And as uncomfortable and gross as that feels right here in my chest, I find that reflection, once I get over the initial feelings of inadequacy, are what keep me going and what make me a better doctor at the end of the day. So it's necessary, I think, as ER physicians. Yeah, we get to leave our work. We get to leave, whatever happens. We don't get messages from whoever's on. It's shift work, right? But it's important to do that reflecting for your future patients.